Hello and welcome to today's Age Well webinar. My name is Allison Schneider, and I'm the Education and Training Manager at Age Well, Canada's Technology and Aging Network. In today's webinar, AgeTech for Aging in Place, a standards-based approach to inclusive, secure, and scalable innovation, we will explore key gaps and opportunities for AgeTech standards across priority areas of inclusive design and accessibility, ethics, privacy and security, integration and interoperability, and data governance. In this webinar, we will hear from Shahabuddin Apari, who is a postdoc fellow at the University of Manitoba, Courtney Jenge, no, I said it wrong, program advisor with Aging in Place Challenge Program at the National Research Council of Canada, and Gaivan Noon, who is a PhD candidate at the University of Waterloo. We're excited to have you all here. So for our audience members, this presentation will last for about 45 minutes, and that means we'll have about 15 minutes at the end of the session for any questions you might have. So you may post your questions or comments in the Q&A box, which you can open up, and you can upvote questions and add comments to question there, or in the chat. If you're having a hard time finding the Q&A box, just post in the chat and that's fine. You'll also be able to raise your hand during the Q&A session, and that's that icon is located on your toolbar if you want to ask a question verbally. So you can raise your hand, and when we get to you, we can unmute you and you can ask your question verbally. You can also enable closed captioning in the Zoom toolbar if you'd like those captions during this session. And then finally, this webinar is being recorded and will be posted to the AgeWell YouTube channel. Anyone who's registered for this session will also receive a link to that recording, as well as any resources that we've shared during this session. Okay. So I think that's everything from my end. So I will turn it over to Dr. Aparis to start the presentation.
Thank you, Alison. Let me share my PowerPoint with you. I think now you can see my slide if I'm correct, right?
Yes.
Perfect. Thank you, Alison, for your introduction. Hello, everyone. Good afternoon. I hope you are all doing well. Thank you for joining us today. My name is Shahabuddin Apari, and I'm a postdoc researcher at the University of Manitoba. It's a pleasure to be here and to be part of this webinar today. Let's get started. Today's webinar is based on this Canadian Standard Association report, which was published in September 2025 by our team. I will start with a short overview of the project and the methods we use, and then I will share the key high-level findings from the academic scoping review, the Gray literature review, and the expert consultations. After that, Gaia and Courtney will continue the webinar. And at the high level, this report looks at how a standard-based approach can support AgeTech for aging in place in a way that is inclusive, secure, and scalable. I will keep this practical and focused and address these questions: why this work matters, what we did, what we found, and what it means. It should be also mentioned that this work has produced several related outputs so far. We have one paper published in JMIR Aging, 2 oral presentations at the last 2 AgeWell conferences, 2 papers ready for submission, and another one currently in preparation. So if you are interested in diving deeper, I encourage you to follow those outputs as well. Perfect. Before moving into the report itself, I would like to briefly explain the partnership behind this work. This was a MITEX-funded research project bringing together several key partners: the National Research Council of Canada through the Aging in Place Challenge Program, AgeWell, and the Canadian Standard Association or CSA group. The research was conducted at the University of Waterloo, and at that time, I was a postdoc fellow at University of Waterloo. Now I'm postdoc at University of Manitoba. I also want to emphasize that this was a large collaborative team effort, and I'd like to sincerely thank all of the team members for their valuable contribution. First of all, let's start with a quick definition of AgeTech and aging in place. But because everyone here is already active in AgeTech, I will keep it short, I promise. As you know, AgeTech is about practical technologies that help older adults live safely and independently. And aging in place is the real-world outcome we are all trying to support. The key issue for this webinar is this. Innovation is moving very fast, but the standards and guidance are not always keeping up. This is really important for us. And that gap creates risk, confusion, and real barriers to adoption. In this slide, I would like to address this important question. Why do standards matter in AgeTech? First of all, I need to mention that standards are not just paperwork or compliance checklists. In AgeTech, they are really a foundation for trust, safety, and consistency. They help innovators understand what good looks like. They help purchasers and implementers compare their solutions, and they help users and caregivers feel confident. And importantly, standards also support interoperability and scaling, which is essential if we want AgeTech to move beyond pilots and into real-world impact. Perfect. Before going further, I want to clarify something that often causes confusion for us. In a standardization, we usually deal with two types of documents. When we talk about standards with a capital S, we mean formal compliance-based standards, and these are usually mandatory or closely tied to regulation, certification, or preparation. But when we talk about standards with a small s, we mean best practices or guidelines, and these are usually not mandatory, but they strongly affect how technologies are designed and implemented. In this study that we conducted, to avoid confusion, we use term guidelines for this second group. Also, in this research project, we intentionally considered both types because AgeTech innovation is shaped not only by formal compliance requirements, but also by practical guidance and emerging best practices used in real-world settings. Now, let me briefly describe the problem this report addresses. Even though AgeTech is growing rapidly, the ecosystem is still fragmented. This is important. Standards exist, but they are often hard to find, hard to interpret, and not always aligned with how products are actually built and deployed. So, as a result, adoption is uneven, and many promising solutions struggle to scale into everyday practice. Perfect. In this slide, I want to address the report goal and objectives. The overall goal of this report was to map the landscape, identify key gaps, and provide evidence-informed recommendations. The focus is very practical. How can standards better support innovators? And how can they support adoption at scale while keeping inclusion, security, and usability front and center? Specifically, we aim to identify what standards and guidelines already exist, identify the gaps, understand real barriers innovators face, and provide recommendations for future standards development. Now, I want to talk about the project stages, and methodology that we applied in this project. To this properly, we used a four-part approach. First, we conducted an academic scoping review, screening 736 studies across 8 databases and including 58 relevant papers. Second, we reviewed gray literature, searching major standards organizations like ISO, IEC, IEEE, and CSA, or Canadian Standard Association, as well as organizations such as WHO, the World Bank, and the AgeTech. This resulted in 22 relevant standards and guidelines. Third, we conducted consultation with 10 experts in two focus groups sessions, including policymakers, innovators, and researchers, and analyzed the discussion thematically. I should also note that there is also a final stage which was not covered in the original CSA report that I mentioned. This stage focuses on developing a toolbox in the form of a recommender system. The goal of this tool is to help AgeTech designers and innovators and developers identify relevant and appropriate standards or guidelines based on their specific use case. This final stage is currently in progress and will be completed soon by our team. The reason for this overall design is simple. Standards are not just a research topic and they are real-world tools. So we wanted to combine academic evidence with practical insight and move toward actionable support for innovators. In this part of the presentation, I would like to share some of the key high-level findings from our research. One of the important findings relates to who these standards and guidelines are written for. This is important. Based on the results, most standards and guidelines primarily target designers and developers, which makes sense from a technical perspective. Healthcare providers and caregivers also appear, but to a lesser extent. However, older adults are rarely addressed as a direct audience, and policymakers are also underrepresented. This matters because implementation is not only a technical process. Adoption, regulation, and sustainability depend on broader engagement, and standards that overlook these groups may struggle to achieve real-world impact. Perfect. This slide is about another important finding of our research. When we studied end users more closely, both academic and gray literature mainly focus on older adults in general. While this is useful, it can also mask important differences. Subgroups such as older adults with chronic conditions, those who rely on caregivers for daily activities, or those living in more complex care environments receive much less attention. This suggests that existing standards may not fully reflect the realities of aging in place for many people. This is important for us. If we want truly inclusive AgeTech, standards need to be better account for these diverse and often more vulnerable groups. The final and the most substantial part of this work looks at existing standards and guidelines across four key themes. First, inclusive design, usability, and accessibility. Second, ethics, privacy, and security. Third, integration and interoperability. And finally, data governance. Perfect. Let me start with inclusive design, usability, and accessibility, because this is actually the area where we see the strongest coverage in existing standards and guidelines. There is already a good foundation, and many standards focus on making technologies easier to use, more accessible, and more aligned with older adults' needs. That said, what experts told us very clearly is that real-world practice doesn't always follow the guidance. This is really important for us. Even when strong standards exist, they are not always applied consistently in actual products. At the same time, technology itself has changed a lot. We are moving away from screen and keyboards and toward, for example, voice tools, sensors, and more automated systems. Because of this matter, usability today looks very different than it, for example, did 10 years ago. Standards need to keep up with how older adults really interact with technology now. Experts also emphasize that we need to move beyond outdated ideas about aging and design technologies that respect the diversity, experience, and capabilities of older adults today. Now, moving to ethics, privacy, and security. This one of the areas that raised the most concern in our work based on the academic scoping review, gray literature review, and expert consultations. From the academic side, there is actually very little coverage, which already tells us this topic hasn't received enough attention. The gray literature helps more, but even there, important gaps remain. What experts really stressed is the gap between what guidelines say and what actually happens in real world and in real products. Many age tech solutions give very little clear information about how data is collected, stored, or protected. And when privacy policies do exist, they are often written in a very technical language that's hard for older adults and caregivers to understand, and even for designers and developers. This leads to a trust issue. If people don't clearly understand what's happening to their data, it's much harder for them to feel comfortable using these types of technologies. Experts also raised concern about always-on technologies like voice assistant and what that means for privacy and consent over time. The main message here is that privacy and security standards need to be strong, but also clear, understandable, and truly focused on users' rights and expectations. Now, let's talk about the integration and interoperability, which is one of the most challenging areas in age tech. This is also where we found some of the biggest gaps. Many solutions work well on their own, but they often live in closed or isolated systems. That makes it hard for different devices and platforms to communicate or share data in a useful way. Experts very clearly that this becomes a serious issue when age tech data needs to connect with healthcare systems or clinical workflows. If data can't be shared reliably, understood clearly, or trusted, clinicians may not feel comfortable using these types of technologies. Problems like inconsistent data formats, lack of calibration, and unclear standards all play a role here. It is important to remember that interoperability isn't just a technical problem. This is really important. It affects users directly. When systems don't work together, older adults and caregivers have to work with multiple disconnected systems, which adds complexity instead of reducing it. So the key point here is that we need stronger and more coordinated interoperability standards if age tech is going to support integrated and person-centered care. Perfect. The last thing, I want to talk about data governance, which clearly emerged as a gap in both the literature and the expert discussions. At the age tech, as the age tech becomes more data driven, questions around how owns the data, how can access it, how it is used, and how long it is stored become increasingly important these days. What we found is that data governance is not well covered, especially in academic work. Most guidance focuses only on privacy or security rather than the full data lifecycle. Experts also raised concerns about poor transparency and inconsistent constant practices in real products and real work. The key takeaway is that age tech needs clearer, enforceable, and user-informed data governance standards to build trust and support reasonable scaling. As a conclusion and to close, this report looks broadly at the current standard landscape in age tech. One thing is very clear for all of us. Standards matter. They are essential for safety, usability, and effectiveness. At the same time, important gaps still exist, especially around ethics, privacy, interoperability, and data governance. We also found that many standards don't fully reflect the diversity of older adults' needs or include all the perspectives that matter. As I mentioned, for example, patients with chronic diseases, older adults with chronic diseases. The goal of this work is to help move age tech forward in a more inclusive, trustworthy, and scalable way, one that is grounded in real user needs and real-world care settings. Now, Gaia and Courtney continue the webinar. Thank you so much.
Great. All right. Thank you, Shabadine, and thank you, Courtney, for helping me address my technical shortcomings this morning. So when we talk about the future of age tech in Canada, we normally talk about innovation, as Shabadine discussed, new tools, new technologies, and new pilots. But despite the innovation, what we tend to struggle with is adoption scale and real-world impact, which is where the tired old joke about Canada's pilotitis problem comes from. The key gap there isn't necessarily technology, but rather it's trust, which must be built through deliberate standards development and action. Next slide, please. So through our work, we've developed a set of recommendations to help work towards that building of trust. The report naturally focused pretty strongly in standards development, but during this presentation, I'm going to be focusing on recommendations that have an applicability beyond standards into research and practice, and how we can advance these areas in order to support adoption by fostering trust and effectiveness. These standards, following the organization of the report that Shabadine just discussed, follow four key areas. That's inclusive design, usability, and accessibility, integration, interoperability, ethics, privacy, and security, and data governance. Next slide, please. Starting with inclusive design, usability, and accessibility. Thank you. While substantial work exists on this, both in the standards and the research space, there remains needs for standards that address the specific needs of older adults and their caregivers, which includes accommodating the various cognitive, physical, and sensory challenges that can result from health conditions that have a higher occurrence in older adulthood, such as dementia and Parkinson's disease, or even just normal aging processes. Things like drier skin or some slowdown is a very natural part of healthy aging, and that needs to be accommodated in several forms of age tech, um, as well as needing to account for varying levels of digital literacy. So, what we mean by that is accommodating that through inclusive design principles, through plain language, visual contrast, etc., making sure that the data is interpretable and actionable by clinicians and caregivers, uh, and something that's perhaps a less obvious recommendation here is the need to create guidance for the non-traditional screenless interfaces, which are becoming more and more common here. Voice assistants, ambient sensors, gesture-based systems, etc. These offer ways to accommodate for certain forms of need or disability, uh, but these aren't often designed with older adults in mind, thinking about how we can better accommodate their needs in our attempts to be accessible through these novel technologies. Uh, Next point is the need to define what the usability and accessibility requirements are in order to make them enforceable. Uh, these include the plain language, visual contrast, font readability, and Accessibility Act compliance that we discussed earlier. Here in Ontario, that refers to the Accessibility for Ontario's Disability Act, but of course that will vary by province. Next point would be referring to strategies to promote digital equity. Older adults in Canada live in a variety of contexts, and those contexts vary greatly in what infrastructure is available for them, internet, water, electricity, especially in underserved or rural areas. And then the final point is something that we're bringing up here, but is going to be a recurring theme all throughout, the need to encourage meaningful involvement of older adults and caregivers across all stages of age tech product development, integrating that feedback early and encouraging the gathering of that feedback often. The next area that we are looking at recommendations for is ethics, privacy, and security. AgeTech raises unique privacy concerns due to the nature of health-related data and its use in critical contexts. The exact definition of health-related data tends to vary a bit from province to province, but standards and research guidelines should establish frameworks for informed consent, especially for that sensitive health data, and ensure transparency in how that data is processed and shared. Approaches should focus on translating age tech specific ethical standards sorry, should focus on translating core ethical values into age tech specific ethical standards and research guidelines. This refers to autonomy, dignity, and fairness, and having that be a core component of operational and technical guidance. Next is encouraging the use of privacy-enhancing technologies. This includes things like encryption, data access controls, and audit trails to ensure privacy by design. Next is developing clear standards for obtaining informed consent, especially for that sensitive health data, and supporting users in understanding how their information is collected, used, and shared, as well as the next point. Um, Creating enforceable standards for ethical data handling, covering collection, storage, sharing, deletion, that entire life cycle, and maintaining transparency mechanisms in privacy practice, such as auditability, disclosures of party use. Um, and finally, another recommendation in ethics, privacy, and security. Um, this this is kind of the crux of the direction we're trying to take with these recommendations in this particular presentation. While this work was standards oriented, research, and policy should not exist in silos. So, Courtney, if I get the last point on the screen there. There is a need to promote the alignment between academic research and standards development to really create an evidence-based and evidence-informed foundation for ethical and secure age tech. On to the next area. This third area is in integration and interoperability. As AgeTech solutions grow increasingly complex, standards and guidance are needed to support integration across platforms and regions. Um, as Shahabadin discussed, the lack of standardized protocols and consistent terminology has really contributed to a very locked-in system and interoperability challenges. Um, First way to approach this is uh, really the most automatic place our brain goes to. The need to develop standardized protocol for integrating AgeTech solutions across platform, operating systems, and vendor ecosystems, preventing that locked-in approach. This also includes the need to establish a unified set of terms and definitions related to data governance and interoperability, creating a common language, as it were, um, as well as establishing interoperability frameworks specific to age tech used in home, clinical, and community settings. Um, the reason we say specific to age tech is that this is a very unique field, very unique considerations. The way we design technology and technology ecosystems for use in older adult care and older adult clinical care and community care is going to be very different than other age groups due to the unique needs of this population. Next is defining the minimum performance requirements to ensure consistency across platforms and shared care environments, just having that baseline that can be worked off of. And after that, there is the need for open ecosystems. And how we encourage, what I mean by that is uh, having greater compatibility with other platforms to prevent lock-in, as in you've bought one piece of H tech, therefore every other piece that you buy for this particular use case must be from that exact same manufacturer, even if they do not have all the tools you need. Um, so preventing that lock-in helps to create more customized systems that uh, allow for the creation of solutions that actually match the needs of that particular use case, as well as encouraging market fairness and allowing new solutions to more easily enter the space, which has its values for research innovation, specifically to the age well context. Uh, Beyond that, there is a need to create safeguards to ensure that small and mid-sized vendors are not excluded for interoperability systems. We have some wonderful innovations here in the age-well environment that would fall under this. Um, and there is a need to support the integration of age tech with clinical systems. Electronic health records are the go-to example here, as well as real-time monitoring platforms by developing mapping and security protocols that allow for the data to be used and shared in a safe and effective way. And on the note of data, our fourth recommendation area is in data governance. Existing frameworks often fail to address critical aspects of age tech design, such as data sharing, user autonomy, and interoperability, which presents an opportunity to develop standardized end-to-end frameworks covering the entire data governance lifestyle, from collection to sharing, storage, use, and disposal. There's also a need to, next point please, develop standards and guidance to support the generation of consistent and structured data by age technologies so it can be easily interpreted, shared, and integrated across the various different platforms and care environments as desired and appropriate. Next is need to define the roles and responsibilities of users, caregivers, developers, and healthcare providers in managing and accessing age tech data. This is not only a data governance need, but something that will require the input of those various parties, harkening back to my point from the first recommendations area about the need to consult those groups early and often. Next is need for regulatory boundaries and clarifying those boundaries between the health data and personal data and age tech use cases, developing tailored protections from each. As I sort of alluded to earlier, there's this separation that exists in Canada between consumer data, which is covered nationwide through PIPEDA, and health data, which is protected differently province by province. Here in Ontario, we have PHIPA, um, but these different policies vary slightly between different provinces. Some provinces do not actually have explicitly health information specific policies. Um, so establishing that baseline, first of all, is difficult. And beyond that, AgeTech often falls into a gray area between the consumer data that would be covered by PIPEDA and the health data that would be covered by the various provincial policies. So just that fact, that bit of confusion, has proved to be something of a barrier in the past. And then finally, trust and transparency really is at the root of all of this. So it is critical to design trust and transparency frameworks to improve user confidence in data sharing and third-party access, and addressing lifecycle management consistencies by mandating clear protocols from data acquisition through to disposal. I'm going to end the recommendation section by discussing something that our team has been doing to um, begin broaching some of these issues. Um, and this comes from the fact that um, one of the greatest obstructions to the use of standards is difficulty in determining what is most applicable to you. So what we have been working on here is a recommender tool. We've been calling it AgeLine. And this is a tool to help identify the age tech standards that best suit the innovations of developers. How this works is very simple. You enter in a description into this box here, and the tool uses natural language processing to help identify the most relevant standards for you ranked by relevance. These have been identified through a group of experts in age tech standards who identified a core list and then you and then used several example use cases of tech technologies to create a reference point for the performance of the system. It is currently in development, but we have been making very excellent progress on this, and I would be happy to share more information on a later date.
Okay, thanks, Gaia. So just to wrap us up here, I'm going to spend some time. My name is Dr. Courtney Gensch. I'm from the National Research Council of Canada, and I'm going to talk about what a path forward for age tech in Canada might look like. So this image right here, it kind of positions us at a potential turning point in the innovation ecosystem here in Canada. We have two potential futures here. We have this future where innovation is moving very quickly and it's supported by shared pathways and infrastructure. Or on the other side, we have the alternative where we see the infrastructure that's fragmented, which has lots of stop signs and barriers, a lot of isolated efforts that never quite reach their destination. We need to be really clear that here in Canada, maintaining the status quo is neither desirable or feasible in the long term. Everywhere we look, we're seeing the evidence of systems at risk, we're seeing demographic pressures, and we're seeing increased demand for solutions that are tailored to culturally appropriate and sensitive needs for a multicultural and diverse community. We have to innovate to survive, and we have to create an innovation ecosystem that supports that. So the key point that I want to make here is that the ecosystem is not currently constrained because of a lack of effort or talent or good ideas. There is no shortage of high quality age tech. What's missing right now is the environment that allows those innovations to move efficiently at scale. When teams work in silos, or when companies work in silos, the natural response to encountering a challenge is to try harder to refine a feature, make something more usable. But when you're aligning, or when without those aligned standards, without that alignment across the ecosystem, every organization is effectively trying to build their own bridge across the innovation to adoption gap. This leads to duplication for one thing, but also it reduces the trust overall in the ecosystem, where another company has had a challenge or a barrier or potentially a failure that makes the adopting organizations a little bit more risk averse. That overall leads to the fact that these strong technologies are getting stuck in procurement barriers, trust gaps, and integration challenges. So when we talk about standards-based approaches to innovation, it's really shifting the focus away from optimizing an individual technology towards optimizing the system that they have to operate on. It's about building better roads, essentially. So if it's so clear about what it is that we need to do, why hasn't it happened yet? Well, developing standards and governance for AgeTech is not straightforward, and we need to be really clear about naming that complexity and then finding solutions that address that complexity rather than trying to sidestep it. So first of all, AgeTech is spanning multiple sectors at once. It sits at the intersection of healthcare, social care, consumer technologies, also potentially including housing or community services. And each of those sectors has existing standards and norms and levels of regulation. We also need to be clear that in AgeTech, we have a mixture of regulated and unregulated products. Some technologies fall under medical devices and then therefore are subject to health data regulations. Others are positioned as consumer tools, and yet they can be used in a health setting. So there's uneven expectations around evidence, around safety, around efficacy, and accountability. There's no single purchaser. We have multiple different actors who are making purchasing decisions. They have different priorities, different values, and we need to account for that. We also need to account for the fact that in a lot of cases, the person who is paying for the technology may not be the one who is bearing the risk if it fails, or the benefit if it succeeds. And because we're having to build trust across those multiple perspectives all at once, there is no way that a single standard or a one-size-fits-all is going to work. So what we need to do is create a flexible and coherent framework that accommodates the diversity while still creating that shared expectation that reduces uncertainty. So the complexity is exactly why this governance-based approach to standards is actually necessary. And that's because change happens at the speed of trust. And I want to just take a step aside and look at another industry, which is a great example. So if we take aviation as an example, people get onto planes every day without having personally evaluated the aircraft or knowing who the pilot is or what the maintenance history is. And that level of trust, it's not optimism. It's standards, right? We have shared safety standards, we have certification processes and compliance mechanisms that mean we trust that the system of air travel is built as a safe system. We don't negotiate that decision flight by flight. Because we have that infrastructure, when innovations come in air travel, the innovation can move faster. So new aircraft designs, navigations, they have clear pathways to procurement and certification. And there's also safety mechanisms built in when a new innovation comes in. For example, the 373 MAX 8, which was demonstrated to have safety issues. And that was immediately pulled off the market for reevaluation and then recertification eventually before it was allowed to fly again. Essentially, where we are at with AgeTech at the moment is everyone is making an individual decision about an individual airline, an individual airport, or an individual country every single time they're interacting with the product. It's just slowing us down, the costs are really high, and public confidence is quite low. So I just want to, preface this by saying that standards-based innovation, it doesn't remove responsibility and it doesn't remove individuality. It really creates a trusted baseline so that we can move away from proving that floor, that minimum accepted standard about safety and legitimacy, to really being able to focus on what makes a specific technology a differentiator and delivering that real world impact. On the flip side, what happens when we don't have those standards? What happens when we don't have those trust? Well, okay, you can see in this cartoon, you have a pretty healthy looking person saying, well, my watch told me that I didn't have a pulse, so I thought I should come to check it out. And, you know, sure, we can kind of laugh at it, but it points to a real problem, because if a consumer device is producing results that neither the user or the system knows how to interpret or trust, then it becomes a system clogger. So when the trust and governance are missing, the technology doesn't sort of fail quietly. It ends up creating confusion, anxiety, and ultimately a strain on our clinical systems, which frustrates the clinicians who are already dealing with huge amounts of data. And now they're being asked to take on more data that they can't validate, that they're not accountable for. And patients are left, or, you know, users are left in that uncertain middle point. So when we create that noise, it creates an additional risk to the overstretched system. So ultimately, if we want to avoid these healthy people, we need to make sure that the technology is trusted. What does a trust framework for AgeTech look like? Well, we can look to academic literature about what creates trust. And we can start with the principle of integrity. And that is the belief or the perception that the thing or the person adheres to a certain set of standards or a certain set of principles or values that the user finds acceptable. Then there's also competence, the belief that the thing or the product or the person is actually capable of performing the tasks that it is claiming to do effectively. Benevolence, which is the belief that there is a positive intention or a beneficial outcome, so that there is best interest for the person who is engaging with that piece of technology or tool. Transparency, meaning openness and accessibility, clarity about information, methods, assumptions, potential limitations, and accountability, which is the responsibility of somebody, either the seller or the developer, to justify their actions or decisions and their use of resourcing, showing responsiveness to ethical and social expectations. So when we understand what creates trust, it enables us to then start to think about how we can create a governance framework that embeds these principles of trust across the life cycle of design, deployment, and evaluation. So what does that look like? Well, we've come up with this as a governance model. It's 4 central pillars, which is underpinned at all times by the principles of equity and justice. Starting with, on the far side here, guidelines and standards for AgeTech development. And the purpose here is to break down the life cycle of trust into bite-sized and actionable pieces. So the guidelines and standards for AgeTech development is about creating shared expectations around safety, accessibility, privacy, interoperability, and ethical design. The important part to note here is that this isn't one central standard. It can be unique to different kinds of systems for medical devices, for consumer devices, ambient living, et cetera, et cetera. The purpose is to create a toolkit that can be pulled on as appropriate. The second one is evidence-based impact and accountability. Trust is dependent on being able to answer the basic question of, does this work, for whom, and under what conditions? The need for consistent approaches to evaluation, reporting, and accountability allows us to make decisions that aren't based on claims or anecdote, and also enables us to really align our impact measurements and our evaluations to the metrics that the eventual users feel are important. The last is pathways, or not the last, the third is pathways for scale and spread. So we've talked a lot about the fact that technologies are struggling to make roots into public procurement systems. And so when we can create alignment on standards and processes, innovation is less likely to stall at pilot stage. Now, this is less about creating a standard with a big S and more about creating opportunities for shared learning, communities of practice, leaning into the organizations across Canada that are really doing this well. And the last one here is informed consumer access and empowerment. If you think about something like a certified organic sticker or an ISO standard or a CSA standard for car seats, hair dryers, those are symbols or those are certifications that indicate that a technology, a device, a tool has met a certain standard. So it removes the requirement for the individual to do that fulsome evaluation of privacy, security, ethics on their own by creating a recognized global standard. So these pillars are not to eliminate complexity, but they're to organize it. They are to give us a way to move away from the fragmented efforts into coordinated action and from isolated innovation into impact at scale. So again, this is just how this might manifest. So, building in integrity at the design stage, building competency and transparency at the evaluation stage, and then benevolence and accountability at the eventual deployment. So what does this boil down to? Essentially, this is a call to action. In AgeTech, there is not a single regulatory body that can solve this. We don't have one organization that has a mandate to tackle all of these things together. So progress depends on how we choose to act together. We need to build shared infrastructure, including things like repositories where standards can be developed and maintained, common reference points for innovators and systems and consumers, and pathways that can support spread and scale across the contexts. Acting together, again, it doesn't mean uniformity, it means alignment. It means agreeing on some foundational expectations so that innovation can remain diverse while the impact becomes realized. When we choose to invest in shared infrastructure in a strategic way, it's a decision to stop optimizing in silos and start changing the conditions under which innovation can choose to happen. So essentially, when we want to make sure that AgeTech has the opportunity to deliver on its promise, then creating that shared environment isn't optional, it's foundational, and it's shared work. So I invite you all to participate in that shared work in the years to come. In conclusion, standards and governance are infrastructure that innovation needs to thrive. We can choose to optimize in isolation, or we can choose to align for impact. I hope that you will all join us in that decision to align for impact and really enable us to realize the benefits of AgeTech as an invisible infrastructure for innovation here in Canada. And on that note, I am very excited to say that the National Research Council Aging in Place program and AgeWell are embarking on a joint project at the moment to co-create an AgeTech impact metrics and evaluation guide. That's going to be a Delphi-based consensus generation process. It's going to be launching in the spring, and we invite you all to participate in that process. You can reach out to the team at AgeWell or by emailing that NRC Aging in Place email in the on the slides and hear more about what we're planning to do and what the timelines for that look like. And the final slide, I just wanted to take a moment to recognize the contribution of Dr. Josephine McMurray. She contributed immensely to this work, in particular, this vision of what could be. And we're very grateful for the perspective that she shared. And we wanted to take a minute to honor her contribution here. Thank you so much.
Thank you very much, Courtney. And Gaia and Shavdin, thank you so much for your presentations. I appreciated how you structured this and how they build on each other. We had a few questions that were posted throughout the webinar. I feel like some of them have been answered, but I'll start it off. As we're looking at this, we're creating this standards-based approach. Are there jurisdictions even globally, that might already be doing this well, building trust and creating those standards that we can look to as a model?
That's a fantastic question. I wouldn't say there is any one country that has a fulsome age tech trust framework. I would say there are some countries that are a little bit more able to align innovation and impact. So when we look to some of the countries like Japan, when we look at Korea, Taiwan, there are much faster innovation to implementation pathways because there's policy and governance to support that. You can also look to examples like Germany, where they have a more standardized process for evaluating the impact of new technologies and procurement pathways that are much more structured. When you look at things like insurance models, there is a lot more clarity about how the benefits between the payer and the user are traded off. So there's lots of examples internationally of good practices that we could lean onto, but we need to be conscious that this is a public system. There's 13 health systems, and within that, lots of different health authorities. So I wouldn't say there's one place internationally that we could look to and say, we could copy that, but there's lots of opportunities to learn.
Thanks, Courtney. Yes, we have a very complicated system that's unique, and that brings different challenges. So important that we're taking this on. When it comes to the timeline here, you were speaking to that, Courtney, a little bit about how it can be faster, say in other jurisdictions that already have certain standards in place. Some people might say that this process could slow down some of the actual implementation and real world based solutions. So what would be your argument to say that this won't slow things down? How do we convince people that this will actually help get things to market, to consumers, to the people that need them in hospitals, etc.?
So I would say there's two types of standardization. There's compliance-based standardization and there's best practice-based standardization. Compliance-based standardization, yes, can slow things down. However, it is also necessary for safety, for privacy, and we have that already for medical devices. The benefit of a compliance-based standard is that the process for that is extremely clear. So when the process is clear, it becomes part of the innovation journey. The challenge that we're seeing now is that there's a lot of small s standards that are not clear, and their role in innovation implementation is not clearly defined. So as we can create more shared standards and shared understanding of what becomes a prerequisite for adoption and implementation, and then create that transparency about what matters to adopters, then it actually speeds up the entire process.
Great, thank you, Guy or Shabadin. If you're interested in responding, please feel free. There is a question here about what would form the basis for interoperability. Would this be a reference guide? Where would someone start if they're thinking of developing or designing an age tech solution, which is compliant with these future standards?
Abedin, do you want to take that?
Yeah, actually, I think we had another question regarding the interoperability between AgeTech solutions and EMR and EHR systems. I would like to also answer to this question. I think this is a great question, but this is so difficult question. This is a well-known and long-standing challenge. This is only, I would like to provide only my personal perspective. I'm not sure about the accuracy of my answer. Actually, in terms of interoperability challenge, this is as I mentioned, this is a real challenge in this domain, in all of the health information systems and health informatics domain, and also in age tech domain. Based on my opinion, I think in practice, age tech companies should not try to, for example, build a different version of their products. And also based on the results of our study, the experts were very clear about that. And also I would like to provide my thought in this matter, companies need to design their product to be standard ready from the start, using common data formats and interoperability standards. And I think this makes integration easier for us. And also, I think the companies can use a modular and API-based design in this matter. This allows the core product to stay the same while only the integration layer changes when needed. And also regarding the designing process, I would like to emphasize on co-design approach. I think the key of many of the barriers and challenges in health informatics domain and also specifically in age tech domain is considering the co-design approach. We need to involve all of the end users, older adults with different perspective from the first stage in design process. So in this webinar, I would like to emphasize on the co-design process in our designing and developing the age tech solutions.
Great. I'll just acknowledge that we are at time, but do all of our speakers have 5 more minutes for Q&A?
I do, yes.
It's okay. Okay. Well, we'll stay on for those of you that are able to stay. Please do. For those of you that have to go, we understand, and thank you so much for joining us. Okay. So Courtney, you wanted to address that as well?
Yeah, I just wanted to say this really goes back to the comment about the shared digital infrastructure. There's a lot of information existing at the moment, but it's very hard to find at the moment. It relies a lot on individual skill to be able to identify the right standards, identify the right guidelines. So creating that shared digital infrastructure that centralizes these resources and makes them more accessible, more transparent is going to be a really important step for the Canadian innovation ecosystem. So that was all I had to add to that.
Yeah, thank you. Yeah, centralized and easy to find, and all of these things are really important. And there's been a call for this for some time, I feel like. Gaia?
Yes, thank you. So as Shabadine said, it's difficult to give, you're going back to the original question, it's difficult to give a straightforward answer of where to start because this is such like a multifaceted issue that will require several actors to address. But as part of that, I wanted to highlight the work of the PATH platform. PATH is an acronym standing for Program to Accelerate Technologies for Home Care. AgeWell is actually a strategic partner of the PATH platform. They have done quite a bit of valuable work in looking at how we can better have interoperability in home care technologies.
Yes, thank you. Yeah, based at UH and Kite.
Yeah.
Yeah. Okay, so let's do one more question. So this is a question from Mark. So who takes the lead? How will we work together on this to actually bring this AgeTech framework into the light, as it were? Is it government? What do you think, Courtney?
You know what? I think this has to be consensus-based. If it's imposed by any one actor, be that a nonprofit or a government, then it's naturally going to encounter more pushback. It has to be something that the ecosystem collectively decides is of value and therefore is willing to embrace. So that's my ultimate statement. Now, that doesn't mean there's not room for leadership in this. So it depends on who has capacity, who has the network, who has the oversight to be able to turn what is a neat idea into an actionable process or platform. So in short answer, leadership is one thing, but participation is essential for its success.
Yeah, definitely. If I can add to that a little bit as well. While it is great to have champions, perhaps, in the government level, government moves very, very slowly, and is very at the whims of whoever is in charge and whatever results from latest election cycle. So if we are going to be waiting for this to come top down from government, we are not really going to get anywhere, and that is why it is really important for that leadership, that seeking of consensus, to come from uh, actors in research and innovation that do the on the ground work and push this forward.
Thank you so much, Gaia. I'm going to wrap things up just because we're 5 minutes late. But this comment that Sandy just put in, he actually really well put concluding remarks together for me. So I'm gonna read that. So Canada can build trust, break down data silos, and scale inclusive age tech. We can give every older adult the dignity of aging safely and independently in a place they call home. So that's an excellent summary. Thank you so much. This was a really great webinar. It is being recorded, will be posted on the AgeWell YouTube channel. I'll send a link to everybody who has registered. And also note that next week you can join us as well for another AgeWell webinar on February 10th, the same time, 12 p.m. ET. We're talking to the head of innovation from VHA Home Healthcare, who talks about a practical approach of evaluating AI translation in home care. So implementing some of those technologies in a practical way. So the link is there if you're interested in learning more. Thank you all so much for participating and for your questions, for your presentations. Thank you so much for being here today. And it really excited as much of this webinar, but especially, I don't know, because this does feel like we're building our momentum in 2026. This is our first webinar of the year, and I think it's started us off right with where AgeWell, in collaboration with many other organizations and government, can go. So we're very excited. Thank you all so much.
Thank you, Allison.
Thank you so much. Have a
Okay.
wonderful rest of the day.
Bye, everyone.